Right, hello, welcome to Halftime with Tim. Thank you for everyone joining this call today. This is just a chat and an opportunity to just chat with people, especially about just sharing live stories, live experiences, shaping events. So I want you to just sit back and enjoy yourself. I will be right back with my guest today. So just enjoy the music for a few minutes. Apologize that we're starting a bit late. We just want to put everything in shape before we begin. I'm trusting that you would have a fantastic time just listening to amazing stories and how people find purpose. This is about, halftime basically is about how people in the course of their journey found purpose and they found what drives them. Yeah. In football match, there's always half full and first half, right? So there are many people in life, they've enjoyed first half of their life, whether it's either you're winning, you're losing, or it's a draw. Yeah, and that's why you have, this football pitch. Life in itself, is like a match. The question to you is that what half are you in? And what is the score? This is end of January, right? What is the score like for you? So are you winning? Are you losing? Or you are just in between, right? And that's what we're going to talk about today. For a football match, after the first half, what happened most often, every football match, there's always a first half, and what happened most of the time during the first half determines the halftime, which is the most important part of any football match. It determines the outcome of the second half, which is the final match. And a good coach would sit with his players in the locker room and they re-strategize. They would look at the formation again. What we have played, the way we have played in first half, is it going to deliver to us, the best result in the second half? Even in the halftime, period in a football match, a coach can decide to, change a player and just, reformat, the strategy. And so you are in January. In case in 2024 you lost, don't worry. It's not the end of your life, right? This season is supposed to also be the halftime where you revamp your strategy. You check your formation. If there are certain things that you need to, take off. A football coach will look at a player that is not maximizing, his potential on the pitch, and he has the courage to change such players. What are the character? What are the behavior? What are the lifestyle that has not allowed you, right, to win in 2024? Do you still want to go into 2025 with that same approach? I think it's time to have a rethink, to sit in the locker room. And for a Christian, the coach that helps you in the locker room is the Holy Spirit, right? And then sometimes you have a personal talk with yourself. So today I have a guest in the room, in the locker room. She'll be sharing her experience on how she transitioned, from her first half into the second half of her life, of her career, and the critical moment that changed everything. She'll be sharing what led to our halftime story. Basically, she'll be sharing our halftime story. I want you to sit back and enjoy the rest of this conversation. This will be many more of this kind of story that will inspire, that will encourage you that life in itself is in halves. So depending on how you are fed in the first half is not the end of the game. And I want you to know that you will win in the second half of the year. It may be January, but I want you to type on the chat, I am winning, I am winning, I am winning. And then while that is going on, I like to very specially, invite my guest today. Right? Let me reduce the volume. Our guest is already in the building, and it is my Ayelomi Oluwanifemi Idowu. She's an assistant chief dental nursing officer at Luth. She's been there for over 15 years of working experience. She's a registered, please help me, please. I need you to help me appreciate my guest before she gets in uh, with an emoji, right? She's a registered dental oral nurse and a highly motivated professional, with experience and progressive. I love that. She has experience, but she's progressing, right? A progressive learning in dental nursing and extensive involvement in cleft lip and palate care. Uh, in this kind of environment, you don't go into cleft and lip palate just because you feel like doing it. It has to be a second half or an half time experience. So she specializes in promoting a good oral health for individuals in the city. Nifemi is a public speaker. She has presented in conferences, seminar, various um, uh, outreaches. She's also a teacher and a serial entrepreneur. Nosni Femi has an MSc in view from the University of Lagos. Nosni Femi, I believe that you should be. The applause is so high, and we like to just have you join the call. Let me ask you, for those of us who are on the call, have you had your own halftime moment where you had to change, your strategy, change your approach, even to life? Please share your experience with me. On the call, Nosni Femi, are you still there? I think it's important that you join us now. Let me know. And on this call today, right, you would hear, you will learn what it is to, what cleft lip palate is, and what the amazing work that she's doing in that space, just helping children, you know. Let me, just a moment. I'm going to try to add that again. Dustin Femi, you must join us today so you can share your halftime story. Halftime story. Right. I think you're back. Come on, everyone on the call, please help me appreciate and welcome our guest for today. Whoa, no Femi, welcome, welcome, welcome. So good to see you. So good to have you join us today.
Thank you for having
I believe it's going to be an interesting conversation. Yeah. All right. So, no Femi, yeah. But you look great, by the way. You look great.
Thank
You look great.
you. Thank you.
And maybe I will have the opportunity of sharing how I met you.
Oh, okay.
Yeah, but it's not yet time. So let's keep
Okay.
that as suspense. Yes,
All right.
such a pleasure to have you join us. So, Nonsi Femi, please, who are you? Beyond the short profile, I know it was a long one, so I tried to
Yeah.
to compress it. Yeah. So please, who is Nosni Femi? Do you want to just very quickly just describe who Nosni Femi is, and let's take it
Okay.
off.
Okay. So I'm Nifemi Ailomi. a mother, a wife, uh, a registered dental nurse, and a volunteer, a teacher, and an entrepreneur. And I have a lot of passion for children that are born with cleft lip and palate, and I've been involved in the care for those children for more than a decade. And yes,
Wow. So before you got into nursing, what were you about? What were you doing? How did you pick nursing of all things, of all profession? Why nursing?
okay, I've always wanted to be a nurse, actually a general nurse, not the one that is based on oral health, but I guess God always has a way of doing things. So, so after my WAHEC, I was waiting with jam severally, and then it looks like jam was jamming me. so, and so
Oh, so Jam also
my
jammed
mom,
you too.
yeah, he
I
did,
thought
he did, he did.
that was the only
I
one.
was at home for like 2 years. He jammed me, so I wrote
But how many
some
times?
other
How many times
exams,
Jam jam you?
just twice, just
Just
twice,
one.
just
So I'm
twice.
better than
So yeah, kind of.
just kidding.
So my mom just felt like, okay, you've always wanted to be a nurse, and then took me to the school of technology in Akure on those days. So we were wearing white, but I didn't know that it wasn't for the general nursing. It is more about it is more about the oral health. So I went into it not even knowing what I was doing, but I loved the fact that I was caring for people, and I am still caring for people. So that's why I said that God has a way of doing things. And so after that phase in my life, I was able, because then there is no the the consciousness about oral health is not so much then. So not to talk about being an assistant in the with a dentist. So that was how I started, and then God was just on my side all through. After my school, I was able to get a job. Then I furthered my education. I have BSc in administration from Unilag. I graduated in 2014, but then I knew I wanted more. I know that okay, even if I want to be in the administrative line, I still want to pursue this health. And so I kept going. So I got the opportunity. So that was, let me say, that was my first phase. And then my second phase is getting the opportunity in 2013 to join the Cleft Care team in Luz. And then I got exposed to children that are born with cleft lip and palate. And then my passion grew. So it was first the opportunity. I didn't really understand. Then when I started meeting the parents, meeting the children, I understand. Then when I became a mother, okay, so it got done on me. I really understand this because I understand the fact that you carry a baby in your belly, you are expectant of what you want to see. You want the baby to look like your husband, look like grandma, have the height of this, have the lip of this, and then boom, you give birth to a child, and then the child has cleft. So I understand how the mothers feel because when I had my first child, my child was not didn't weigh so much, was just about 2.8 kg. And I've always been on the bigger side. And they're like, can you see? She's a nurse so, and still a child. You know how people have a way of saying things, a whole lot of things. So I almost withdrew from my child, from my own child. I was almost going into depression. So
Wow.
fought I fought to get hold of my life. I fought my husband, fought my mom, I was then my friend that was with me was one that told me, if something is wrong with you. This is not just about this. Because I felt like everybody was expecting too much from me. I was getting blamed for maybe being small and me being on the chubby side. I don't understand how that one is my fault. and 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 there is a fight about give your baby something else, and I'm like, I want baby to feed on breast milk. It was a real tug of war. So I felt like my child doesn't have care. Yes, people are blaming me for baby looking small. The baby is almost as tall as me now. So I felt like if they could do that to me, how much more someone that gives birth to a child that has cleft. It they do not even know. Many of them don't have not even heard about cleft before. Yes, they have that child. So I just try to relate my own experience to this experience, so the passion just grew. I wanted to be there because that time I didn't really have somebody to listen to me. Well, a lot of people were listening, but they don't understand. So, and when it comes to these children and their parents, they cannot just talk to people anyhow because they will not give them the kind of advice that is expected. So I feel like being in the earth line, I understand what is going on. I'm in the care of the students, so I give them listening here and also a shoulder to lean on. So that was where I got my passion for cleft care, and I just thank God because it's an opportunity, and I love it, and I'm pursuing it. So that is it.
Yeah, thank you for that. Background and story. Very, very interesting one. So you just been talking about cleft lip palate. Someone is wondering, what does that mean? What does that? What are you talking about? Are you saying that a
Okay.
child and they had the dada on the hair or what? No, not dada. What's that?
I don't know which I don't know if I can share a picture. I don't know if I can do that now, a picture of it, but for whoever that is watching, you can just go to my page and see a child that is born with cleft lip or palate. So now let me first say a lip is this is your lip, and then the palate is the roof of your mouth. So when you say a cleft is more like just a minute, please. Just a minute. So cleft is I'm sorry. Uh, sorry. Just a moment, please. Okay. So as I was saying, cleft is an opening. So this opening can be on the lip or on the palate. Like someone gives birth to a child, and then it's that the part of the lip is open. You can imagine the image. It can be one side, it can be on the two sides. Then the child can open the mouth, and then you can see the roof of the mouth is open, or one side like on the lip is open, and also the inside of the mouth, at the roof of the mouth is also open for a baby that is just being born. And so this is what cleft lip and palate is. And for a mother that probably has never heard about cleft lip and palate before, you can imagine what is going to happen. Giving birth to a child and say that the lip is cut, or on the two sides, or one side, or the palate. Some of them will just kill me. Some of them just say, no, this is not my child. There's a lot of denial. They will just say no. Some people will even blame the nurse. It must be the nurse that caused my child while I was delivering. Is because you know that it's easy for them to always put blames on the medical personnel in Nigeria. Nigeria, they don't know what they're doing. They must have caught the baby. They must have done this. It's even okay that they are putting the blame on the medical personnel. But what about the parents? So they will say it must be the mother that has done something wrong. The mother must have fornicated or must have done something wrong, and that is the reward. It's an evil thing. It's
Or could
recently.
it be that the mother got the baby from mommy water or something like that?
I
Or
think recently, someone told me that our own sister, told her that she had given birth to an ancestor. You can imagine that she has given birth to her ancestor. That the person that our sister had given birth to, that the person must be a warrior in the life before, and then when he fought, he had a cause, and by the time he died, it wasn't repaid. He has
interesting.
given birth to that child. So
Interesting.
this is not far fetched at all. This happened just this December, like December a month
Interesting.
ago, and the person is we are in contact. So because of all of this, I know that the awareness is very low. So I dedicate almost, in fact, all of my social media pages to talk about cleft lip and palate. So if you click Nifemi Ayelomi on Twitter, you will see something that has to do with cleft. Or Nifemi Ayelomi cleft, you will see Twitter, Instagram, Facebook, TikTok. I just put it there because I cannot imagine Do you even know that people endanger the life of these children because they just think they are an ancestor? It's a taboo. The mother must have done something wrong, and the father must, a lot of things, a lot of despicable things that they say. Someone was around recently, and for 2 days, a newborn baby was not fed. They didn't feed this baby for 48 hours. Reason, because the baby must be is the baby is what is this thing called? Must be a must be, I don't even know the name. Was like a taboo. So you cannot feed them. You don't know if they are going to take that kind of food. You don't know if they want to feed on breast milk. The awareness is so low. And you keep wondering, why do you want to endanger the life of these children when it can be taken care of? So this is what it is. And so because it can be taken care of, because it is not a taboo, because it is not an incurable disease, that is why someone like me and a lot of other people that are doing this are coming out to talk about this. That cleft lip and palate is not something that is, it is not something that is extraordinary. It can be taken care of. And guess what? Anybody can give birth to a child that has cleft lip and palate.
No,
That's what
please say that
people,
again.
anybody can give birth to a child with cleft lip and palate. Trust anybody. It doesn't have to do with economic status. It doesn't have to do with your social status. It doesn't have to do with your level of literacy. Anybody can give birth to this, to children that are born with cleft. And you may want to ask me what the causes. That is why
Yeah,
a lot of
I was going to segue into
okay,
that to say
yeah,
what are the myths around some of it you already mentioned about. How can I, as a parent, future parent, prospective parent, yeah, prevent, because the truth is that we all have a picture, right? Just like you said at the beginning, a picture
yeah.
of a baby that you want to give birth to, how
Like
do I
caramel and
avoid it?
chocolate
Yeah,
something.
yes. It should have my nose, it should have my
Yes,
lips, it
all.
should have, and then boom, the baby comes out, and then you are wondering, where did this come from? How can
Yeah.
I prevent this? Uh, are there myths? Are there myths that people are still, accepting, and
Hold
then
on to it.
how can parents, prevent? Are there preventive measures?
Okay,
Because
so
what you are doing
there
right
is,
now is that uh, you are managing the process.
yeah,
There's difference between prevention and management. So I think you
yeah.
are playing in the management stage of space, not prevention. So can it be prevented? That's one of my questions to you.
So first thing I want to say is that in this part of the world, I don't know if I can say unfortunately, because I won't say unfortunately because there are some of it that helps us. See, our beliefs, our culture, our background have a lot of impact on us. Some are negative and some are positive. So this belief that children that are born with cleft lip and palate, they are they are taboos. What is permission to say this in Yoruba? They will say Orisha. What is Orisha? Like they are deities.
Ancestor, deity,
Yes.
deity, yes,
And so yes,
deity.
they just believe that they are not normal. We need to educate people. We need to create the awareness. They are very, very normal. Very, very, very normal children. Some people will say that it must have been something that you ate while you were pregnant that caused it.
I
That it must
heard
have
that.
been
I
that
heard that.
you walk. They even say that you must have walked in the night, or you
No, in
must
the
have been
afternoon.
in the afternoon,
When you go to
autumn,
the
12
market in the
o'clock.
afternoon, and
Mm.
then one
Or you
woman
must
will
have,
just pass by you, and then they change
or when you
what is
went to the
inside of that.
market,
They
you
find
went to
out.
go and yab one old woman. You are the one, you talk too much. You said something to old woman, so the woman did this, and then it happened. You know, or they will say, or they'll just some people will just be worshiping those children. You know, why some people want to throw them away, want to do away with them? Some people will start worshiping them. Ah, this must be my grandfather. This is my, a lot of things that happen, and they just do a lot of they do things also that can endanger these children. So that's about the myth and belief. See, a lot of things that you cannot even think about is what they are saying about these children. So what can we do? No, let me first start from what is the cause, because it's when you know the cause that you can know what can be done. So
Absolutely.
now, what is the cause? The truth is that the actual cause is not known yet. To
So
say that this exactly is
what are you doing to go and look for the cause?
a lot of researches are going on, a whole lot of it. There is Nigeria craniofacial anomaly research team, there is Africa craniofacial anomaly research team. There are researches going on everywhere in Africa, Asia, Europe, USA. See, there is research going on everywhere, because I always tell the parents that when there was an outbreak of polio, we asked there was a need for research to know what exactly is the cause. That is why we can have polio vaccine today. So this research is going to keep going until we get the actual cause. We have been able to see things that can contribute to be a cause, but we've not been able to get the actual cause. So because we have some things that can be contributing factors, so we are now saying for every woman that is of childbearing age, that means you know that, okay, let me say it in the way because I gave a lecture 2 days ago about this at a hospital. So let me just say the way I said it. I said, if you're a lady that you are about to marry, you want to go and marry, or you are planning to marry someday, you have to just live a healthy life.
You have
Live a healthy life
you
and
have to do what?
live a healthy life,
All
a
right.
very healthy life. Eat well cooked meals, take a lot of fruit, take water, do not smoke, do not take alcohol. Most
Please,
importantly,
please increase your volume
take
to that.
folic acid.
Increase your volume.
For people at the back to hear, I mean, for people at the
Yes,
back
yes,
to
yes.
hear.
People at the back of the hall, they need to hear. Please increase the
So I'm
volume.
going to say it again.
Increase the volume.
Live a healthy life, eat well cooked meal, take
Mm-hmm.
lots of
All
water,
right.
take
Right.
lots of fruit,
Mm-hmm.
do not smoke, tobacco, shisha. Hold on, I will not reduce my mic. Quiver. Someone is saying I should reduce my mic. I will not reduce this mic. So, I see you. So, don't take alcohol. Do not smoke. It is important not to smoke. Don't take alcohol. Now, and also take folic acid. So, folic acid are very tiny and they don't even cost at all. They're not costly. Just before, but before you know, when you know that, okay, I'm going to get married in the next 2 years, 1 year, start taking folic acid. Live a healthy life. Eat clean. Do you understand? Exercises. You don't have to go to the gym to go and register at the gym. Walk, take water, all of those things. Just live healthy. You don't have to copy people because people are doing things doesn't make that it's okay. Because people are doing some things doesn't make it okay. So you have to understand that. And now, after you have done all of those things as a female, also it can be genetic. It can be in the trait. It can be in the gene. It can just be very silent. It can be very recessive. Can you take coke? Yes, you can take coke, but you have to reduce it. So you have to. It might even be in the gene. So you will say, "I've not seen it before. Nobody has this in my family." But how many of your ancestors do you know? How many of your grandparents did you even meet? How many of them do we know? So it can be in the gene. And one of the leading things that research is leading us towards now is that it can be genetic. Lack of folic acid can be a huge contributing factor as well. That's why we encourage that people should take folic acid. Aside from that, what does that say again? Folic acid, it can be genetic. Environmental pollution.
How does
Environmental
that affect?
pollution. Now, that alcohol that I mentioned the other time, no, there is something that is called fetal, fetal alcohol syndrome. So, the babies have the syndrome in the womb while they are still in the womb, just because of just because of the amount of alcohol that is in the system already. So by the time
Wait,
the
sorry,
mother
sorry,
conceives,
forgive me. Is it alcohol in the system of the father or the mother? Can it be transferred?
okay. If you want to say
Because I
that
find it,
we are pregnant, you have
interesting
to do
that
it
we are just
together.
talking to women. I know most women don't drink alcohol. All this you are talking about, are you sure it's not from the father?
Let me shock you. A lot of women drink alcohol. They take
I'm
alcohol.
not aware.
Some women smoke a lot.
Interesting.
Some women smoke a lot. Yes, they do. I know that when they are pregnant, they'll say hormones are playing on them. Like I saw a patient recently, and he was telling me that she didn't take alcohol, she didn't smoke, but she was eating charcoal. I had to ask what kind of, because I was confused, just the same way you expressed that I was like, what? But you cannot express it too much as an earth worker. You have to make it look like, okay, it's not a big deal. Talk to me. I be like, charcoal. I'm like, what kind of charcoal? She said the normal charcoal now. The charcoal where they take cook. I'm like, the black one. Say yes. So I don't understand. How did you say? The thing will just be hungry. She will just be eating it, just be chew am. I'm like, while you are pregnant. Now, all of these things can contribute to it. Then smoking. See, all of these things can happen periconceptional, like 6 months periconceptional. That means around the time that 3 months before you get pregnant and 3 months when you just get pregnant, the things that are in your system can affect your baby. So we need to know this. It is very, very, very important. That's why I was hammering on the living healthy life. But now let me tell you something. Cleft lip and palate forms in the early time of pregnancy, between 6 weeks to 9 weeks. The one
Right.
that forms late is around 12 weeks. So between 6 to 9 weeks, even what this thing is already done. That's why we are saying that even at 6 weeks, some people are not even aware that they are pregnant. At 9 weeks, they don't know. Some people are even pregnant for 3 months and they are not aware that they are pregnant. That is why we are clamoring on living a healthy life, because you don't even know when this conception is going to take place. And because it happens in the early stage, a lot, like now, like I said, all of these things, they are periconception. That means around the time that you are going to conceive, all of these things are happening. 3 months before and 3 months after, there can be retention of this alcohol in your system, all this smoking, all these things. Smoking, you can be an active smoker or a passive smoker. So now this is where the daddies come into place. Daddy, if you are smoking and mommy is
No,
in the house,
don't look
you are
at me.
the one
Don't
that
look. I'm not talking. You're not talking to me. Just look in that direction.
okay, okay.
Better, better.
Daddy, so if you are smoking and mommy is in the house with you, you have turned mommy also to a smoker. Because mommy is now a passive smoker, daddy is the active smoker. So the fact that mommy is inhaling this smoke, the effects of it is accumulating in the system. It can make mommy that is not actively smoking to have this. So it can happen because all of this is a contributing factor to the fact that can make someone to have a child that has cleft lip and palate. So all of these things need to be put into consideration. And the most important thing is that it is not the end of the world, even when it has happened. It is not the end of the world. A lot of people endanger these children. They do a lot of things to them. Well, it can be Yeah, and most of the time is what people will say can make them do all of these things to these children. They hide them, they force feed them, they keep them, the mouth. Somebody that has a cleft palate, that means there is an opening in the roof of the mouth, and you are now force feeding them. You know the way they used to force feed us when we were young, to put us on the leg, our parents. You didn't experience that. You must be a butter. They will do that.
Please, don't expect.
I did not cast you.
Don't
you
cast me,
know,
please. Is it part?
imagine if they
You
do
know,
that.
it's not that time. It wasn't
It's
baby
not
food. It
custard.
was
It
really
is not
pap.
custard. It is
It's
not
pap.
custard. It is
Ogi
the
baba.
red one. Ogibaba. You are in the spirit.
Abi na.
Ogibaba, the original one. You know the smell and the color, not the one that is diluted now. When you give them, now imagine a child that has cleft palate doing that kind of a thing to that child. The child will aspirate it. It will obstruct the baby's breathing, and that's just it. So that's why we are advocating that these children, they can live their life. It is repairable. And imagine, it's even done for free, absolutely free, sponsored by an organization that is partnering with us at Loose, Smile Train, and everything, every single thing, including surgery, including admission, including drugs, including every other, because this treatment is going to go from face to face. Everything is done for free. So what else? And you don't need Nigerian factor. All you have to do is just to locate where they are partnering, and then the child will be same. So why does anyone want to endanger them when they can even get the treatment and they can live their best life? You know, we are even trying to carry out a research because we have seen that children that are born with cleft lip and palate, they are doing exceptionally well in their academics. Exceptionally well. Most of them, especially when they're not syndromic. Exceptional children. So what else do you want? And we have to shout to create this awareness because the one that the society is contributing is even a big deal. They bully, they stigmatize, and they will now make those children when they when they are still babies, when they are babies, it is the parents that are experiencing the bullying. That's why they want to do anything to those children, hide them, keep them, do a lot of things to them. That's for that. But when the children grow, they experience bullying. Why are you talking like that? Why is your mouth like that? Why is this? We parents, we have a lot of work to do on our children. We have a lot of work to do on them. And it is very, very, very important. So the children experience bullying, and that's why there's a psychosocial group for them. Many of them, you see that they don't talk to people, they just withdraw socially, they don't have friends, they just want to stay on their own because they would laugh at them, because they will bully them, because they will say a lot of things to them. They're not living their best life. That's why we are trying to come out. Stop the bullying. Let there be an inclusion. Love them, care for them. It is not a disease. Not as if when you talk to them you also catch it. What are we talking about? And it is repairable. So
So you are saying that there's a corrective surgery
yeah,
for cleft lip and palate,
yeah.
and that's what you have dedicated the rest of your life to, because that's the essence of this event or this conversation. How people just dedicate their life to a worthy cause. Uh, I mean, if you think about an average cleft lip and palate case, there are different character or stakeholders. So you have the parent, you have the children or the child involved. Who else do you
The
have
health
also? Is
workers
health workers. So I
are
think
caring
what
for
you're
them.
doing is helping uh, those families to what's the right word to use now? You're giving them another chance. You are helping to create an opportunity for the children, especially to live their best life, to maximize their potentials, to sort of, at least to an extent, right, reduce the pressure, the stigma, you know,
So boost
to
their
reduce,
confidence.
yeah, confidence. So tell me, how exactly did you got into this? I know you said it, but was there an event that really broke your heart? Okay, yeah, you said it was when you gave birth to your own child, and then your baby had was very smallish,
Yes.
yeah, and you felt like if you that you even have a child that is not, that does not have cleft palate can go through this, how much more, right, with a child or a parent with cleft lip and palate? Thank you. So how has the journey been for you, and what have you done so far with this? Almost like it's a crusade, right?
Yeah.
How is it like, just jumping on this crusade? Is it really exciting, for you? Are there challenges? What do you want people to, as you go on this crusade, in quotes, yeah, where do you require, in quotes, support? You want to create more awareness, for instance. How can people
Exactly.
partner with you on this journey such that we can continue to give these children? Because again, these children, right, they did not do anything
They haven't done anything wrong.
to serve.
They've not done anything wrong. They only came to this life to come and enjoy their own life.
So how are you helping? And then what has the journey been so far? What are the lessons, for instance, that you have learned in the process of giving? It's almost like you are giving people joy again, right? What does the feeling look like for you? Can you really say that, the first half of your career, you started as an admin assistant or something like that, you venture into nursing, and then you have done general nursing, that's almost like your first half, and the birth of your baby actually created that halftime experience that helped you to rethink, what am I even living for? Uh, can I really exert myself, my passion, for something that is worthy of emulation, something that will last for the rest of your life, right? That was a defining moment for you, and then the post halftime, how has the journey been for you? What is the feeling that comes to you when you see a child go through the corrective procedure, and how, after the procedure, how you've been able to nurture? What are the things that you are doing? I know you have a camp for children born with cleft lip and palate that
Yeah.
happens every year.
Yeah.
I'm hoping that next year, no, not next year, this year, uh,
Yes. Yeah.
I'll be there.
Yes.
I'll be there to either give a talk. I'm just giving you invitation ahead. But
And invitation
you're really
accepted. Invitation
you're
accepted.
really doing an amazing job, and
Thank you.
I celebrate what you're doing. While
Thank
others are looking to get money, but you are focusing on giving children life meaning. Helping to reduce because imagine a child was not treated. I've
you.
had experience. Maybe I should now open up. But before I open up, okay, please tell me about the story.
Okay, so I'm going to start from saying that I feel fulfillment in doing this. It's a volunteer work. It's a small train organization that the one that is sponsoring this, and it is absolutely for free. That the one that is caring for that they have dropped their money. They need dedicated people to do this. So at LUS, Lagos University Teaching Hospital, we have a team that I am now opportune to be a part of. We have a coordinator, Professor Emo Ogulewe, and then in LUS is the only hospital in West Africa, if I'm right, that has a complete cleft care team, absolutely complete cleft care team. And yes, it deserves a round of applause. So, and what I see is that I see a lot of dedicated people, a lot of people that are willing to do all of those things, and that makes me happy. And yes, my fetal as a dental nurse was just to care for the mouth, to assist the dentist in caring for patients, to just take care of themselves. So I feel like that one also made me to understand that okay, this is how the mouth is supposed to be. This is how the lip is supposed to be. So this is the normal function that is supposed to be. So when there is something that is different, it's easy for me to identify that something is wrong. So when I had the opportunity to come into this, I took it not really understanding, but of course, when I had my baby, it broke the ice for me. And I'm in it. So now, for Luz, we have our cleaning days, we have psychosocial programs for them, we have parties for them, we have all the parties that do Christmas, so children's party, we celebrate them every time because we are introducing that inclusion. That inclusion is important. And we have a camp. We always have speech camp. We call it smile camp. Or the last time we called it it was a summer. Yes, we called it smile summer camp. So what we do is that we get all of them together for a period of 1 week. We initially were doing 2 days, but now we went into doing 1 week. We get everybody together. They have a therapy rehabilitation session, which is for speech therapy, and then we have fun. We play. Look, they have a lot of talent. They have talent because they sing. In fact, their Christmas carol, the one that we did last time, come and hear angelic voices.
Really?
It's on my YouTube page. Yes, it's on my YouTube page. This on my Instagram page. You know, they will just feel like they can't talk. They sang beautifully. There was choreography. There was a time that they painted now. They did artwork. See, they're not disabled. They can live their life. They only have that anomaly that can be corrected. One of the challenge that can happen to the one that has cleft palate, that's the opening on the roof of the mouth, is that sometimes they have issues with their speech. And then there's speech therapy session that we take them through to help them to be able to speak well. That going to have they're going to be almost as if nothing has ever happened to them and they are living their life. Most of them, the issues that the challenge that they usually have is the challenge of is social challenge. People are not accepting them. People are bullying them. People are asking questions. People are intimidating them. People are saying that don't come to my team. I don't want to. The way you are talking, I don't like it. The way you look, I don't want it. You know, that is the most of the issues. And we are like as I said, we have a lot of researches going on. We have done researches on mental health of the parents. We have done researches on because their mental health is very important because look, what you don't have you can't give.
Mm-hmm.
If you're not mentally stable, you can't take care of a child. So at a point we take a pause, like we have been caring for these children. What about the parents? Everything that we are doing and we are giving, it has to be done by the parents. What if the parent is not stable? What are we going to do? So we looked at the parents to also help them. We looked at them as well. So all of these things are happening. So during the speech camp, even the parents come around, they are happy. They see that their children are improving. They see that a lot of things are happening. They are happy that their children are doing well. Do you understand? They understand that their children are doing well. So they are happy about this. So what I'm saying is that all of these things can be taken care of, and there is no need for the discrimination. It is actually not needed. So that is it in summary, because of our time, actually. So that is it in summary. And for me, I'm happy. I'm happy doing this because I'm happy to see smile on people's faces. You know, when you give birth to that child and you're worried, and after the surgery, of like, oh, you see a sigh of relief. You see that happiness, you see that genuine happiness on the parents. What else can we ask for? So that is it.
Wow. Wow. Thank you, Nurse Nifemi. What else can I say? Please, if you are
Okay,
still
just one more thing. Just
yes,
one more
please.
thing. So now what I want to say is that I cannot do this alone. I take it upon myself to advocate about this. A lot of people are doing it in the village. That's why I have a YouTube page, Cleft Care with Ifeanyi, to talk about cleft. My TikTok, my Facebook, my Instagram. I try to put information about cleft there as much as I can. But the truth is that I cannot do it alone. That's why I'm on the social media. So that it can be spread. We need to spread the awareness. We need to create the awareness. People need to know. Now that everybody that is on this live now knows that cleft lip and palate can be repaired, you can also share the news. Follow me, I'll follow you back. Don't worry, that's not a problem. Because I want the information to go. Because we need to spread the information. How much can I do? How many people can I reach? Do you understand what I'm saying? We need to
Yeah.
create the awareness because they can live their life. They can be they can be taken care of for free, absolutely free. So what else? I have people that love them. Please, let this the awareness for me. When we know that this diet can be taken care of, so I think we are going to move. So that's it.
I mean, thank you very much, Nosnifemi. I called you to talk about yourself, but you have spent almost 35 minutes
It
talking
is
about
this
what you are
passion.
passionate
It is
about.
the
Yeah, I
passion
want
that
to
is
just ask
burning. This
anyone
passion
on
is
this
burning.
call, go and find your passion. Go and find what gives you joy, what you're passionate about, because there are no passionless human beings. We only have
Yeah.
people who are able to identify their passion. It is not about money. Yeah, when you find your passion, money will follow. Yeah.
Yes.
Thank you for what you're doing and how you are giving people another opportunity to live well. I
Thank
think
you.
maybe one more question. Okay, you have said how people should partner with you. Uh, is there a place where are there future projects, especially for whether it's creating awareness? Can people even give towards? I mean, there are many sides to managing a cleft lip, palate patient in quote, right? There's a psychology part of it. There is counseling, yeah, whether for the parent or for the child. If you get my point, yeah. How can people really partner with you? I know
Okay.
you belong to Smile Train. How can more people sign up to put in their voice, to lend their voice into what you're doing, this laudable project that you are about?
Uh, even the Nollywood part is even a good cause because we are even thinking of putting this in cinemas, maybe videos so that people can learn more about it and they can see and they can know what we're talking about. So how we want to partner is that I know that Smart Train is taking care of everything for now, but Smart Train might not be able to be here for forever. So I'll just say that I think my battery is going down. So I'll just say that you can kindly reach out um, to me on my page, just send a DM, then we can continue from there, or we book another session. I'm always ready, and then we can have more. But
Okay,
you
so
can
you,
talk.
you have also
Just
you have also requested for an invitation, right? 2411.
one word.
But thank you
Yeah.
very much for your time. I
Thank
know you've
you.
been at
Thank
work since morning and you decided to
Yeah.
stay back, to have this discussion. Thank you very much. We are
Thank
on
you too.
behalf of
Thank you
everyone
for the
listening.
invitation.
We are really, really proud of you, and
Thank
we
you.
look forward to hearing good testimonies about what you're doing and the Smart Train team are doing.
Thank
I
you.
said maybe I'll leave this for the last comment, which is I actually met Nosnifemi when I took my own son, yeah, for a surgery, for the same corrective surgery. I think the third time, right? And the way what endeared me to her was the she was just different from every other nurse and medical personnel that we got there. and we started to have the genuine interest that she had, for my son, made me to connect with her. I think about 6 or 7 years ago,
Yeah.
and the relationship is getting stronger and stronger.
Yeah.
Thank you for
Thank
the
you.
great work that you're doing. Uh,
Thank
I'm in
you.
this with you, right?
Yes. Thank
I may not
you.
be a
Thank you.
nurse, but in any way that I can support what you're doing, I'm for it. Thank you very much.
Thank you.
Our
Thank you so
guests,
much.
thank you. Please help me celebrate and appreciate Nosni Femi for coming on this show. Thank you, and our regards to your husband. I'm sure I
Thank
was going to ask how you balance between family,
you.
work,
It's not
and all.
easy,
That's a
but
discussion for another day, right?
for other day.
Uh,
Yes.
we
Yes.
leave it there. Yeah, but thank you,
Yes.
thank you. Let
Thank
the
you.
applause
Thank
keep going. Thank you. We love you. We love you.
you. You
For
love you
teachers,
too.
they
Thank
say
you.
their reward is in heaven. But
Yes.
you
My
could
own
be
is
in
on
heaven,
earth.
but you also
I'll
get
collect
some here.
my. I'll collect one more. I'll get it here.
All right.
Thank you so
Thank
much.
you very
Thank you
much.
everyone
I'll
for
see you
joining.
another
Thank
time.
you.
Guys,
Yes.
we have more of these beautiful stories of people changing, the narrative of how people have experienced their first and second half. Watch out for more stories like this. People doing amazing things for themselves. God bless you. Have a fantastic rest of the month. And as you step into the month of February, you are winning already. God bless you. See you again next time. This is Tim. Bye for now. Yeah, just before I go, and if you have any of such inspiring story of how you've been able to navigate your first half time and how you are living your second half, please reach out, send a DM. If you know anyone who has a beautiful story like this, please reach out, send a DM, and then we'll pick it up from there. God bless. See you.